Meet Susan. She has a 3-year-old daughter, Emily, who has frequent tumultuous tantrums that occur at inappropriate times, and she's emotionally withdrawn from her family. Emily has difficulty connecting with her peers at daycare, and she suffers persistent depressive episodes. She may be exhibiting signs of emotional behavioral disorder, or EBD. Let's find out.
EBD? What's that? Hi, I'm Jane, a representative from the Parental Advocacy Coalition for Educational Rights, or PACER. All children exhibit signs of emotional or behavioral conflict, but it's when these problems are consistent that they lead to EBD. The definition consists of many parts: behaviors that are extreme and chronic, that are blatantly unacceptable due to social or cultural expectations, and adversely affect academic and social performance. The symptoms of EBD can be exhibited internally through anxiety, depression, or social withdrawal, as well as external behaviors such as aggression and irritation. From the behaviors that we've observed from your daughter, she represents notable signs of externalizing EBD.
Oh my, is there anything we can do to help her?
Well, there's this little thing called early intervention, where services and support can be made available for children ages 0 to 3. To help with disabilities and developmental delays, it's important to keep track of Emily's behaviors to share with the primary care physician. Keeping records is one of the best ways to properly diagnose EBD. Because she has exhibited signs of EBD, she is eligible for early intervention already. Here, we can teach both you and your little one about EBD and ways to use the interventions.
I'm a little hesitant about this. I don't want to single her out because of her possible disorder. Where can we find these services? What kinds of benefits will come from early intervention? And is there anything our family can do to help with these interventions?
When suspicions are first arise, you can take your child to their primary care provider. There are strategies you can put into place during the evaluation and assessment process at home to help Emily. Implementing predictable, strict daily schedules to increase comfort and familiarity with everyday routines at home will decrease Emily's stress. You can also consistently use positive reinforcements to promote desirable behaviors, as well as scientifically proven appropriate consequences like timeouts and loss of privileges. From there, you may want to see a psychologist or a psychiatrist for both you and Emily.
For the both of us?
Yes, both you and Emily would benefit from talking to a professional about this. Your family can participate in family psychoeducation. Here, you will learn about the disorders your children may have, as well as what you can do to help them. Emily can benefit in many ways by interacting with a cognitive behavioral therapist. She can learn social skills, coping mechanisms, and self-regulation. When she gets older and attends school, her teachers can assist her by creating simple yet clear rules, allowing her to take small breaks during class time and promote intrinsic motivation.
This feels quite overwhelming. What if she's just a problem child? Is this too overbearing for such a young kid? What would happen if we chose not to use early intervention and just see if she outgrows these behaviors?
Yes, this is a lot of information to take in at once. But even if she is not diagnosed with EBD, taking these precautions will improve her social, emotional, and academic well-being. These interventions will give Emily a toolbox of strategies to help her live her best life. Whether she is diagnosed with EBD or not, these skills will benefit her throughout her life.
You know what? I think you're right. Diagnosing this kind of disorder must be difficult. Whether Emily is officially diagnosed with EBD or not, these are valuable skills for her to have. I'll talk to my family about implementing some of these strategies for both us and Emily, and I'll set up an appointment with her pediatrician. Thanks, Jane.
Understanding your child's behavior can be one of the most challenging parts of being a parent. This is how Susan got help for her daughter, and you can do it too. Thanks for joining us, folks.